All good things come to an end, including therapy. But psychotherapy ends in a large number of different ways, and that's what I'll talk about today. Some of those ways are premature, before the therapy's really over, whereas other times therapy ends when it's finally finished. It should go without saying that ethical therapists want psychotherapy to end. We're not in the business of trying to keep you there forever. I'll talk about that too. This is the 9th video in my playlist on the basics of psychodynamic psychotherapy, the traditional form of psychotherapy that's been around for decades. So that's my focus in this video. I'm Dr. Stephen Reidbord, a longtime psychiatrist and psychiatric educator. If you like what I'm doing here, please like this video and subscribe to More Than Meds. Most therapy ends prematurely, before it's really done. And often that's for reasons that are really external to the therapy itself. On the patient's side, they may lose their job or otherwise lose the ability to pay for therapy. Their health insurance might change, or it might be limited, for example. Or the patient or client might move out of town. Maybe under those circumstances, the therapist either isn't set up to do virtual treatment, or that's not the nature of their practice, or if the client moves out of state, the therapist may not be licensed in that new state. Patients also sometimes stop therapy because they change their mind. They thought they wanted therapy and they decide they don't. That does sometimes happen. And sometimes when they feel there's a really poor fit between themselves and their therapist. It used to be traditionally that therapists were always taught that that was a form of resistance, that was a defense mechanism against getting involved in therapy, claiming that it's a poor fit. But studies, some research has shown that sometimes if it feels like it's a poor fit with therapist number one, you go to see therapist number two and it's a better fit and things work out better. On the therapist side, of course, therapists eventually retire or maybe have to close their practice for medical reasons or some other kind of reason like that. Again, that has nothing to do with the specific patient. It's just about their practice in general. More commonly, the nature of their practice changes. For example, I am a teacher and supervisor at a training clinic for psychiatry residents, that is, physicians who are specializing in psychiatry. And they're in the clinic providing medication management or psychotherapy for a year or 2 years sometimes. And so as that academic year ends, they need to say goodbye to all the people they've been treating. And that's a unilateral ending. It's not something the patient wants. And it's really important, we teach this in the training program, to explore the feelings that arise when a therapy is ended because of things like the end of the academic year. Even if the person gets a new therapist with the new academic year, one of the first things to ask about is, how did you feel about the previous therapist having to leave? One of the important points in all of this is that it feels very different depending on who's doing the stopping. If you've ever dated anyone, and I hope that's true of most of you, you know it feels pretty different if you're the one breaking up versus the other person is breaking up with you. If you're breaking up, you may feel okay about it, or maybe you feel a little guilty that you're disappointing the other person. But if the other person's breaking up with you, it could feel like you're being rejected or abandoned. And that feeling frequently comes up if for some reason the therapist has to end a therapy before the patient or client is ready for that to happen. In any healthy therapy relationship, this should all be talked about. The idea is not that it's just, here's my new rule, we're going to stop therapy, or for the patient or client to say, I've made my decision, I'm out of here. Hopefully there's an ability to talk about it, to explore what's going on and why either person is choosing to do that, and also the feelings that get stirred up in the patient. There are other times that therapies end that do have to do with what's going on in the therapy itself. Over 100 years ago, Sigmund Freud talked about what he called a flight into health. And what he meant by that is that early in psychoanalysis, a patient might say, I'm feeling all better now, it's time for me to leave, when it was pretty clear that it wasn't over. They hadn't gotten what they came for. They were still suffering the problems that brought them in, but that they were, in fact, escaping therapy by claiming to be well. There are also reasons that have to do with therapeutic impasses. An impasse is when a therapy gets stuck. There's some paralysis. The patient and the therapist feel like they keep going around in circles, they're not getting anywhere. And likewise, there can be feelings that get stirred up of frustration or anger by the patient or client towards the therapist. Obviously, all these things ideally can be resolved in therapy. There can be a discussion of a flight into health. There can be a discussion of the impasse and maybe a combined effort to get past it, right? If there are some strong feelings getting stirred up in the therapy dynamic, hopefully that they can step back a little from what's going on and reflect on that and try to understand what's going on, maybe even benefit from those strong, unpleasant feelings that had arisen temporarily. But sometimes that doesn't happen, and the therapy ends, and it ends before it's really finished, and that's the end of the therapy, even though they did not get what they came for. While classically psychodynamic psychotherapy and psychoanalysis don't have a predefined length, they're open-ended, there are versions of psychotherapy, including psychodynamic psychotherapy, that has a predefined endpoint. It's designed to be a 12-session therapy or a 16-session therapy or a 20-session therapy. And as you might expect, those therapies end when that number of sessions have been completed, whether or not it feels like it's finished. Now, there are good reasons to have open-ended therapy, and there are good reasons to have time-limited therapy. They both have their pros and cons. Some of the reasons to do time-limited therapy are to focus the discussion. It really does tend to narrow things down and focus the discussion if you know that there are 10 sessions left or 6 sessions left. There's a little bit of pressure to get to the point, to try to resolve the problem. It moves things along. Also, it tends to recreate the sense of loss that a person might be working on regarding something in their outside life because it's being recreated in a certain symbolic sense in the therapy itself because there's an endpoint coming up. In contrast, traditional psychodynamic psychotherapy and psychoanalysis is open-ended. There is no defined endpoint to it. And that can be a source of anxiety for a lot of patients. A lot of patients are very wary, very concerned about the possibility of getting dependent on their therapist. And a feeling of dependency is not uncommon, and it's really okay, especially in the earlier parts of a therapy relationship. But ultimately, we therapists are not out to have you be dependent forever. We want to make ourselves obsolete, one patient at a time. I have a video about that specifically, that you can take a look at. If there are feelings of dependency, that's something that can be discussed and hopefully worked through in the therapy itself. That's not a good reason to stay in therapy forever or very long term. And it's something that we hope that a person can overcome. Their sense of dependency, or for that matter, if they just have a fear of dependency, we hope that you can overcome your fear so that you can get the help you need. Open-ended psychotherapy is like painting a painting. If you're painting a painting, there's no exactly one last paint stroke. If you're painting, it looks like it's getting close to being finished, it's pretty close to being done, you might get a feeling. You may dabble with it a little bit more. Of course, it does end. There's some final stroke of paint that you put on the canvas, but what that final stroke is pretty arbitrary. And long-term psychodynamic psychotherapy is like that. There isn't an obvious single point in which it's time to stop. It gets to be feeling like it's about time to stop. And how do we recognize that? Well, first of all, maybe obviously, the patient or client should be doing pretty well. They should be feeling okay emotionally. Certainly the issues or symptoms or problems that they came in with initially should be dealt with. But even more than that, psychodynamic psychotherapy and psychoanalysis aims for more. It aims for general well-being, a general sense that you're comfortable in your own skin. That doesn't mean, happy 100% of the time, but it means that the various frustrations and challenges of life don't throw you too much. And if that's the case, that may mean that psychotherapy has done its job, that it's about time to wrap it up. Also, the relationship is still positive. It still feels like a comfortable place to come and talk and to work on emotional issues, but there isn't that much new coming up anymore. It feels less needed or essential. Nice to have, but not really required. And when those feelings kind of come up, it's really up to either party to start to talk about the idea of wrapping it up. A really important point here is that a successful ending of a psychotherapy should be a collaboration. It should be an agreement between the two parties. It's not like the therapist decides when the therapy's over and tells the patient. And it's not like the patient has to escape from the therapy and make a unilateral decision to leave. It should be something that the two of them talk about together and basically agree on. And when that happens, the therapy enters what we call, traditionally, the termination phase of treatment.
Arnold Schwarzenegger is the Terminator.
And what that means is that when both parties decide it's time to wrap it up, they don't stop that particular session. They leave some time to wrap up loose ends, to leave time in the therapy to reflect on what ending feels like and what it means. Often this will stir up new emotions and new associations, new thoughts in the patient. And so the patient or client and therapist agree to an end date in the future. And the question of how far in the future varies depending on a number of factors, especially how long the therapy has gone on. So if you've only seen a therapist 10 times, you don't even need one extra termination session to stop the therapy. But if you've seen each other 100 times, you'd probably want to have a few sessions to wrap things up once you've decided you're going to stop. And the extreme example of that would be psychoanalysis, say, that has been going on 4 times a week for a number of years, and there's hundreds of sessions that the two of you have had. And under circumstances like that, there could really be a substantial amount of time between the time that you agree that it's time to wrap it up and the time of the very last session. So what happens during this termination phase of treatment? The first thing to really stress is that it's still psychotherapy. It should feel about the same, actually, as the therapy has felt up to that point. But it's going to feel a little bit differently because the end is in sight, because you know it's ending. What gets discussed during this period varies from person to person, but frequently there's a kind of reflection on how the therapy has gone, a sort of summing up of how it's gone and what sorts of issues have arisen over the course of the therapy. Sometimes there's reflections on how the therapy relationship has gone. generally positive usually, but it doesn't always have to be positive. Sometimes there's a little bit of airing of grievances that the patient has not mentioned up until that point. Sometimes there's some mixed feelings about leaving. It can feel very positive, but also a little bittersweet that it is ending a relationship that has been meaningful, even though it is a professional relationship and also in some sense a business relationship. Still, it's a personal relationship that will be ending, and there are feelings connected with that. It's very useful for the patient to be able to talk about that in the termination phase of treatment. Therapists, of course, don't talk as much about our feelings regarding the termination phase of treatment, but I can tell you in general, or more generically, that it's a little bit like seeing your kids off to college. You're going to miss them, and it's sad in a way to see them go, but also it's the natural thing that has to happen, and you wish them well, and you want them to be independent and to be healthy without you having to look after them as children. And it's a little bit like that. It's a good feeling, even though I do miss patients that I've worked with for a long time who have finished their therapies and have terminated their treatment and left. One thing I'd caution, particularly therapists who are watching this, is that it really needs to stay therapy until the very last minute. Sometimes there's a real inclination to do a lot of self-disclosing, like the therapist hasn't said anything about their personal life during this whole therapy, but now that it's ending, sure, I'll tell you about my spouse and my children and where I live and so forth. I would caution therapists not to do that. It's not helpful, particularly for the patient to know those things, even right at the end. And also it's important for the patient or client to maintain a certain mental imagery of the therapist even after the therapy's over. And if you suddenly change who you are in terms of how disclosing you are or the attitude you have in the therapy just because it's ending, it's going to disrupt that internalized sense that the patient has about who you are as a person. One thing that I always say, and that actually a lot of therapists say in one way or another, is that the door is always open for a patient or client to return if they want to. And I think it's important to conceptualize this such that if a person does come back, they're continuing the same therapy. It's not a new therapy because you're the same two people. You're still doing the same kind of dynamic that you were doing before. In contrast, like I was saying earlier regarding the training clinic, if one therapist leaves and another one comes in, often we talk about that as continuing the therapy with the new therapist. It's not really continuing a therapy with a new therapist. It's a new therapy because that's a new person. It's very common, healthy, expected for the patient or client to internalize the therapist, to have the therapist in mind after the therapy's over. Frequently, former patients will tell me, I thought in my own mind about how we would have discussed this in therapy if we were still doing that, and that's fine. This video is part of a playlist on the basics of psychodynamic psychotherapy, and here's a link to the playlist. Also, you might be interested in the first video in that series, which is about psychodynamic therapy in general. Be sure to subscribe and get notices of my future videos. Thanks, and I'll see you next time.